We're seeing a sharp increase in COVID-19 cases nationwide and statewide, mainly because of the Delta variant and Omicron, which could soon be on the way. But if and when it arrives, there is a way you could fight the deadly virus. WDHN's Robert Smith Jr. joins us now live in the newsroom with more. Robert, you talked to a doctor about this new treatment. What did he have to say?
Yeah, hey Amanda, this week Pfizer developed a COVID pill that has proved during a study that it decreases hospitalizations and can fight the Omicron variant. The Alabama Department of Public Health is reporting over 850,000 confirmed cases of COVID-19. And with the two variants like Delta and Omicron spreading throughout the U.S., the number could become more frightening in a few months. But Pfizer manufacturer has found a new way to battle the virus by creating a COVID-19 pill.
It's a new tool in our stack to fight this virus. It works in a different way than anything that we've had before.
It's not the first time we heard about a COVID pill. Merck and Company invented the treatment in October, but it has not been approved by the FDA due to its low effectiveness. Pfizer says their experiment shows a 90% protection rate against severe disease and reduces hospitalizations and deaths if given to high-risk adults within a few days of their first symptoms.
Most people who get it, who are healthy, do okay. Now, some people don't, but that's just the way it is. But for people that are at risk of a severe disease, like people that are immunocompromised, for example, that means their immune systems don't work well, or they have other medical conditions. This might be life-saving.
Since vaccinations became widely available at this time last year, hospitalizations have been on a decline. Statewide, there are 398 COVID-19 patients, 13 of them receiving care at Flowers Hospital and 8 at Southeast Health. A recent study shows the Pfizer COVID pill effective against the Omicron variant, which is active in states surrounding Alabama. Dr. Stubblefield says that doesn't mean the treatment can take the place of vaccines. You must utilize all resources.
We're not sure about production of this medication, when it would be available, how widespread availability would be.
Now the next step is for the pill to be approved by the FDA, and if it is, it will be the first COVID treatment that can be picked up at local pharmacies. Amanda?